It was a welcome development to Akwa Ibomite on the fight against COVID-19 as Heartland Alliance opened free vaccination centers in their one-stop shop situated at Uyo, Ikotekbene, Oron, and Eke.
We shall get COVID-19. We are here to tell you, ensure you get vaccinated. It's happening at number 26, Ebeldamina Drive, Heartland Alliance office. If you hear me say, I hear.
The official flag off of the vaccination centers took place at 20 Mina Street, Osongoma Estate, Uyo, on Wednesday, 16 February 2022. In his welcome remark, the Deputy Chief of Party, Mr. Paul Umor, said Heartland Alliance intervention had been keen in identifying and providing solutions to the disease in communities using strategic approach.
Dr. Senior leadership of Heartland Alliance and the entire staff and members and volunteers of Heartland Alliance, I want to welcome you all to this flag off of this free COVID-19 vaccination exercise. Heartland Alliance intervention has been key in identifying and providing solutions to diseases in our communities using our own strategic community approach.
Umor said the community-based approach has enabled his organization tackle HIV in Akwa Ibom State and other states of the Federation, as over 23,000 people in Akwa Ibom State living with HIV are on treatment with 18,000 samples and 97% suppression load owing to Heartland Alliance intervention to ensure that Akwa Ibom State is HIV-free.
1,000 samples, 97% of those samples collected are currently suppressed, owing to our own community intervention in ensuring that Akwa Ibom State is HIV-free.
He said Heartland Alliance will deploy community-based intervention and strategy to ensure every Akwa Ibom person gets vaccinated, irrespective of gender, tribe, or social status.
Today, we are also going to be deploying our own community-based interventions or strategy also to ensure that every Akwa Ibom person gets vaccinated, irrespective of gender, irrespective of tribe, irrespective of social status. We are here to ensure that we carry out this vaccination to the grassroots.
According to him, the vaccination will be taken to the grassroots to ensure that Akwa Ibom State is COVID-19 free.
And make sure that Akwa Ibom is also COVID-19 free.
He said so far in the respective outline, in the last 3 days, Heartland Alliance have already carried out over 134 vaccination in Heartland Alliance one-stop shop around the state.
23,000 persons living with HIV on treatment. And out of our test run in the last 3 days, we have already carried out over 134 vaccinations in our respective one-stop shop scattered around the state.
He called on the support of the public, and organization will deploy community mobilization strategy to ensure that people continually seek health intervention and ensure Akwa Ibomites are free of COVID-19.
We will need your support. We are going to deploy our community mobilization strategies to ensure that people continuously seek health interventions and ensure we live a free COVID-19 free life here in Akwa Ibom.
In his remark, the special guest of honor and Commissioner for Health, Akwa Ibom State Professor Augustine Umor, represented at the event by Dr. Etop NTA, expressed satisfaction on alliance in Akwa Ibom State.
The commissioner, regrets his absence here. He would have loved to be here, at least as the #1 health citizen, to disseminate this information. He said I should, thank Heartland Alliance, for the invite and all that you have been doing in the state.
He used the opportunity to clear the air on the fake news concerning the vaccination and called on more awareness on the vaccination exercise.
Pandemic call. I think most of what is happening is because of, I just wanted to remind the SIO that he has 1 more year to go. Because we're told that when you take the vaccine, you live for 2 years. So you have 1 more, so it's not yet Uhuru. So, yeah, but yeah, we keep watching the space. Thank you.
Declaring the center open, the Executive Secretary, Primary Health Care Board, the Chairperson, COVID-19 Task Force, Dr. Eno Attah, commended Heartland Alliance for extending their tentacles to all sectors in their intervention scheme.
So it gives me great joy to be here today. Absolutely great joy. Heartland Alliance has been working closely with the Akwa Ibom State Primary Healthcare Development Agencies, carrying us along on their activities in the state. I mean, you would have expected that they would stop really at the level of the Ministry of Health, which is their entry point into the state. But they've gone a step further and ensured that the Primary Healthcare Development Agency is fully abreast of all that they're doing, especially because of the communities that they work in, which is really at the grassroots level. So I really commend them on what they've been doing. It is such an amazing opportunity to be able to leverage on the unique setup that Heartland Alliance has with their one-stop shops. And here in Akwa Ibom State, they have up to 4 facilities, one here in Uyo, where we're currently standing. Then I believe the others are in Oron, Ikodekene, and in Eket.
She called for more collaboration to ensure that their services target audience.
On that note, I want to say that this opportunity doesn't present itself often, and we're jumping right on it. And we're making sure that the test run that you've achieved thus far, we can build on it and make it even better by this official opening of the one-stop shop in Akwa Ibom.
TEP courting an official opening of the vaccination center.
It's my pleasure to cut this cake and open officially the vaccination site here. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Vaccination exercise observed by the Executive Secretary.
Don't remove your pen. Yeah. All right.
The epoch-making event, which was anchored by the Director of Programs DOP of Heartland Alliance Limited, by the guaranteed, witnessed an outpour of goodwill messages from NACASS Coordinator, UNAIDSSS Coordinator, SACAPM, and remarks from other partner stakeholders at the event.
On behalf of the Honorable Commissioner for Women Affairs and Social Welfare, let me congratulate Heartland Alliance for this venture, for this innovation. We have been working with Heartland Alliance, especially in the area of screening for cervical cancer for women in Akwa Ibom State, women and girls in Akwa Ibom State. So for the team in Heartland Alliance, well done. And this is telling you that we will flood your centers with women that will come for the vaccination. We are particularly happy that it will make vaccination for people, especially women and the vulnerable, easier, the access to it easier. And because we know what Heartland Alliance stands for, because we know what Heartland Alliance has been doing over the years, because we know that Heartland Alliance stands for excellence and commitment, dedication to service, we are very confident in the quality of service that will be provided.
Essentially, I want to use the opportunity to thank the NGO, the Heartland Alliance, for what we are doing for us. Because our Act, Nigeria Correctional Service Act 2019, made provision for one of the major acts is secured and humane custody, safe, secured and humane custody. and have to make custody. Entails that when emails are in custody, we should try and make provision for them to live a normal life.
So on behalf of my country director, Dr. Erasmus Mora, I wish to congratulate Heartland Alliance for this epoch-making intervention for the community. Heartland Alliance already has been doling out innovative strategies at ensuring increased access to healthcare services for the communities, especially our key population. It's also a well-known fact that people living with HIV are highly susceptible to COVID-19, and it's associated with increased mortality amongst them. So it's a good thing that has just come up. I'm trying to implore and encourage all our PLHIV, including our KPs, to visit the OSS, the whole of Heartland Alliance OSS in Akwa Ibom State. I think we have 4 OSS here, and ensure they get vaccinated.
On behalf of NACA DG, Dr. Gombo Aliyu, the South-South Zone Coordinator, Dr. Uda Daniel wishes to commend Heartland Alliance Nigeria for their effort to not only get one-stop shop acknowledged as a health facility and integrated into the Akwa Ibom State health system, but also to support the primary health care development agencies to roll out COVID-19 vaccination using the differentiated service delivery model across the one-stop shops.
But for everybody, I do wish that the general public will avail themselves of this opportunity and get a jab. All the myth that is surrounded by the COVID-19 vaccination, I think there should be a good advocacy to let them know that it doesn't just exist as being propagated. So this is what I want to congratulate Lion once again for the giant strike and wish them well.
On his part, the state chairman of the Nigerian Medical Association, NMA, and state immunization officer, Dr. Ime Sylvester, called on the general public to access the vaccination center and get vaccinated, then Heartland Alliance for the timely intervention.
On the Akwa Ibom State Primary Healthcare Development Agency, other members of the high table, distinguished ladies and gentlemen. So when Heartland Alliance says they want to partner with us to drive the immunization process with a special group, we are happy. And we are even happier when they say that they will even extend beyond the special group and make this place like a center where anybody in the public can walk in and get immunization services. I think that is what we are looking for, that kind of partnership that will help us drive the process. I'm sure people will be looking at what's happening now. This is a positive development. You see, when the advertisement for vaccine comes from us, the saying is that they are government, that's why they are selling their product. But when a partner who is not government now tells you that this product have tested it and it's good, you should take it, I think that goes a long way to say that it's even beyond those government engagement. And now the general public is made to be aware that COVID-19 is safe, it is efficient, it is effective, and we all know it's free. So please, beyond what we have been told about when you take the vaccine.
The Cradle TV Show and NTA had a one-on-one interview with the following personalities at the event.
This morning we had to go on a road show. We have toured around almost Osonoma Estate and its environs. We took off from our office premises this morning with over 50 of our volunteers. We set off from here this morning, walked up to Timber Shed, up onto Oron Road, came in from the traffic light area, and then as we were going, we were telling people what we are doing and what we are about to do. And we're also giving them handbills. And that handbills we're giving them has information about COVID-19 vaccination, how free, how safe, how effective it is. And we're also telling them where they can actually access the vaccine within here. So they didn't need to travel far, because part of what we noticed that make people not to actually take up the vaccine is because of distance, and because Nigerians are usually impatient people. So that's why it is good that we actually have vaccine center in our one-stop shop now. So the awareness that we have created this morning, and it's not just going to be a one-off, it's going to be an ongoing sensitization. So we'll make sure we continue, because part of what we plan to do was to actually embark on what we call advocacy. We are going to enter into churches, we are going to enter into communities, we'll continue to talk to people and continue to sensitize them. The fact that Heartland Alliance one-stop shops now, we have 4 of them in Akwa Ibom. One is in Oron, one is in Eket, one is in Ikotepene, and then this one here, 4 of them. So as we go around, we'll continue to tell them that all of these shops now are activated, and anywhere you go in, you are able to get prompt attention when it comes to COVID vaccine.
Thank you for having me talk to you. Today's outing was, let me say, an encouragement of the power of collaboration. You know, no man is an island. The state can't do everything all by itself. But with partners that come up to support to ensure that the state's objective is actualized in reaching every single citizen of the state with the appropriate healthcare services. In this case, extending COVID-19 vaccinations, not just to key populations in the state, but to everybody who is passing by this one-stop shop. They can stop in and get the vaccinations at no cost. So that it's a really wonderful development.